Good morning. My name is Dr. Anand Parikh, and I'm the Chief Medical Advisor at the Bipartisan Policy Center. And I want to welcome you to today's event entitled Building Vaccine Confidence During COVID-19, the Role of the Medical Neighborhood. We're thrilled today to be partnering with the GTMRX Institute, an organization that focuses on the appropriate use of medications to improve outcomes and reduce healthcare costs. Today's event occurs against the backdrop of COVID-19 and significant optimism now that we have vaccines, a remarkable scientific achievement to help end this pandemic. As of today, 167 million doses of COVID-19 vaccine have been administered. This has resulted in nearly 1 in 5 Americans being fully vaccinated and over 55% of seniors being fully vaccinated. Today's event also occurs against a backdrop of caution. We have a ways to go with respect to the vaccination campaign. There are circulating variants that are more transmissible and potentially more virulent, and we're seeing Americans exhibit less cautious behavior. An additional challenge, which may grow as supply outpaces demand, is of building vaccine confidence in subpopulations that have been less willing to take up the vaccine: racial and ethnic minorities, white, rural Americans, and young Americans. In fact, on Friday, a new Associated Press New York poll showed that 25% of the American public say they probably or definitely will not get vaccinated. Those polled had concerns about side effects, tend to be Republican, and they are usually younger. Today, we'll explore how to build further vaccine confidence using a multi-sectoral approach to address issues such as side effects, distrust of the medical community, and the feeling by many that they don't need the vaccine. We'll hear from national experts from a variety of fields, including Dr. Bill Frist, Dr. Don Berwick, Dr. Karen Remley. We'll also hear from Katie Capps, CEO of the GTMRX Institute. She'll be announcing the launch of a new national task force on building vaccine confidence in the medical neighborhood, led by Drs. Georges Benjamin and Paul Abramowitz. This will be followed by a discussion moderated by Susan Denser, with a terrific panel of experts, including Dr. Sri Chaguturu, Lisa Fitzpatrick, Bruce Gellin, and Howard Haft. Please utilize the chat function to ask questions for today's event, and we'll try to get to as many questions as possible. Thank you, and at this time, I'd like to introduce former Senate Majority Leader, Dr. Bill Frist, and BPC Senior Fellow as well, who will provide some opening remarks.
Thank you, Anand, and thanks to the staff at the Bipartisan Policy Center and our partners at GTMRX. Today, we've come together to discuss a timely topic. COVID-19 has taken too many American lives. It's halted our economy, it's interrupted our social connections, and it's overwhelmed our healthcare system. Mask and social distancing continue to be fundamental to our toolkit to help reduce our risk of being exposed to the virus and of spreading it to others. But now we have the game-changing tool that will accelerate our efforts to end the pandemic: vaccines. The 3 FDA-authorized vaccines are safe and effective. Vaccines are the miraculous final piece in the puzzle to help us to return to work, to return to play, and to engage in everything in between. Vaccines will save lives. We see an encouraging uptake in vaccinations as vaccines become available to more Americans at no cost. But we are only at the beginning of the road. We have a moral imperative to work as hard as we possibly can and as quickly as we can to reach herd immunity. To get there, we must continue to build confidence in COVID-19 vaccines. And here is how we do it. First, increase trust. Vaccine hesitancy is nothing new. As a doctor, as a physician, I've witnessed some type of hesitancy on vaccines with my patients for over 40 years. But what's new is that many Americans have concerns specifically about the COVID-19 vaccines. Their concerns typically center on the vaccine development and on the approval processes. Throughout the pandemic, public trust in the scientific community has unfortunately decreased. Compounding this, some Americans express skepticism because COVID-19 vaccines received FDA approval faster than many other vaccines in the past, thanks to emergency use authorizations. Moreover, many Americans feel the vaccine approval process has been politically motivated rather than driven by science. In fact, recent polls just for March show that the largest single divide among Americans in their support for vaccination now falls along political lines. The truth is this virus does not discriminate based on political affiliation. Building trust and confidence in vaccines has got to transcend politics. We can increase trust by leading with the facts. And the facts are that the 3 FDA-approved vaccines met the agency's rigorous scientific standards for safety, for quality, and for effectiveness. Those are the facts. We must remove the political undertones in these conversations in order to improve trust, in order to increase the uptake of vaccines, and to reduce preventable deaths. All Americans who can get the vaccine should, regardless of political affiliation, get those vaccines. Number 2, we must leverage public and private partnerships. These partnering connections are integral to successfully building confidence in COVID-19 vaccines. The COVID-19 pandemic is a public health threat that is too great for any one company, any one institution, any one government department to solve alone. So like all other COVID-19 response efforts, building trust in vaccines requires this inclusive, this all hands on deck approach. We need to make the decision to get vaccinated as easy as possible for Americans. We've got to meet people where they are. Employers and businesses and faith-based organizations play hugely important parts in getting people vaccinated. As they are the ones, those institutions, those faith-based organizations, those employers, those businesses are deeply embedded in communities all across America. And public-private partnerships also help us use all resources to get the gettable. These institutions can help take active measures to encourage employees and community members to get vaccinated. One example, faith-based organizations could partner with state health officials to serve as vaccination sites, or they could provide transportation to those vaccination sites. Employers might offer employees paid time off for the time involved in going to get that vaccine. Vaccination, you see, is not just a win for public health, but we know that businesses are going to benefit too. Ultimately, vaccination plays a large role in getting us to herd immunity and fully reopening the economy. Finally, we must incorporate the medical neighborhood in our strategy to build vaccine confidence. We think of hospitals, we think of healthcare professionals, we think of all the others who provide healthcare services who are actually in the communities. All of those are critical to building trust in the COVID-19 vaccines. As a doctor, I know firsthand the amount of trust Americans put in the medical neighborhood, the neighborhood around them, the ecosystem around them each and every day, to care for themselves, to care for their children, to care for their loved ones. There is no more important time than now to tap into that trust and to build confidence in COVID-19 vaccines, as well as vaccines of the future. You know, we have a great panel of experts today that will go into much greater detail about the role of these medical neighborhoods in building vaccine confidence. And I'm excited for the conversation. Thank you all for joining us today.
Thank you, Senator Frist. At this time, I'd like to introduce former CMS Administrator and founder of the Institute for Healthcare Improvement, Dr. Don Berwick, to make some additional welcoming remarks.
Hi, friends. I'm Don Berwick, a pediatrician by training, President Emeritus and Senior Fellow at the Institute for Healthcare Improvement in Boston, Massachusetts, and former Administrator of the Centers for Medicare and Medicaid Services in the Obama administration. My field of work for a long time, decades, has been improving the quality of healthcare around the world. and now even more improving the quality of health. In this regard, the COVID pandemic certainly is a call to arms for reasserting our commitment to learning and improvement at the core of our work in healthcare. The concept of building vaccine confidence through work with medical neighborhoods is also core to the theories of improvement overall. There really are two ways to think about making things better, to oversimplify. One is, unfortunately, too much the tradition and too much the habit, and that is through command, control, incentive, exhortation, trying to force or push people into new ways of being, to change processes through simply insisting on change. That is convenient, it is simple, and it's wrong. All improvement happens through learning, and learning is a shared enterprise, not involving control, not involving command, not even involving incentive. It involves curiosity and empowerment, and the idea that, as we say in the Institute for Healthcare Improvement, all teach, all learn. In the COVID pandemic, we are learning a ton very, very fast. In clinical care around the world, knowledge is speeding from place to place at a pace I've never seen before. A sense of humility and curiosity about how to deal with this dreadful tragedy, global tragedy, is leading us to become more and more curious about how to do better. But it's also led to some real crises of confidence. Do we really know what to do? Can you trust the experts? And through many errors in public policy in the early phases of the COVID pandemic, we've actually enforced a lot of these fears and hesitancy, especially in communities that are quite used to being left out or left behind. People do what makes sense to them. And if trust in science, trust in expertise, trust in the allegations of professionals wanes, then we are in trouble. How do you recover trust? That's the problem that the conference and the Bipartisan Center and colleagues are trying to address. It's done through cooperation. There is no other way. The idea that we can somehow browbeat or even convince people to do things that they don't believe to be in their interest it's a bankrupt idea. It's crucial to address fears honestly and with enormous respect, to engage in dialogue and constant listening so that we can walk on the shoes of the people that we're in dialogue with. Trust is everything. In the pandemic, with respect to vaccine concerns, that's trust in science, trust in expertise, trust in accumulated experience, and trust in the helpers who are trying to reach out to reverse the effects of this pandemic. I think that happens best in communities, in neighborhoods. The terminology that's entering healthcare more and more, and I think favorably so, is place-based approaches to addressing the problems of improvement. And we're going to have to think that way in the COVID pandemic too. Localities, neighborhoods, collectives of people that care about where they live, care about each other, getting together to understand what the problems are and to understand each other. That's the only way. There is no top-down solution. I think in this journey toward dialogue and curiosity and authentic conversation and careful listening, this dialogue is toward trust, primary care has a central role. We need trusted messengers, people who, when they speak in communities, because of their relationships to the communities, have start out with a bankroll of trust. And I think primary care is in that position. Not just, by the way, physicians, all people involved in points of first contact in the healthcare community are potentially the very kinds of trusted voices that are needed to help people become comfortable with what needs to be done in order to stop this pandemic. Some will never agree. Some will never find the sources of trust they need, and that's okay. We just need enough people in dialogue, in authentic search for better, to change the characteristics of the community as a whole. I think that the effort underway here to build trust at the medical neighborhood level is exactly right. And you know what? This is about more than vaccines. It's about more than COVID. It's about an overall approach to improving health and well-being in our communities as a whole. The sources of health, well-being, lie in the social determinants of health and illness, and those lie in the hands of the communities that we deal with. And just as with vaccine hesitancy, we need to talk more about understanding the nature of concerns and the sources of trust in those communities. So when we work on the other determinants of health, be it food security or transportation or housing security or criminal justice reform or environmental improvement or equity itself, we're going to need to do that exactly the same way, in localities, in places, with communities, with shared voices and a sense of real respect as we enter the dialogues that can lead us toward health. I thank you for the chance to share these thoughts with you. I'm so delighted about the effort now underway, and I'll tell you, it's exactly where that effort needs to be. Thank you.
Thank you, Don, for those remarks, and particularly your focus on the role of empathy. Now we're very lucky to hear from the Centers for Disease Control and Prevention, which is playing a leading role across the nation when it comes to building vaccine confidence. Please welcome Dr. Karen Remley, Director of CDC's National Center on Birth Defects and Developmental Disabilities, and former Deputy Incident Manager of CDC's COVID-19 response. Dr. Remley previously also served as CEO of the American Academy of Pediatrics and as Commissioner of Health for the Commonwealth of Virginia. Dr. Remley?
Thank you very much for having me, and thank you to everyone who's on the call and the Bipartisan Policy Center and the GTMRX Institute for hosting this very important call. As you just heard, I've had a lot of roles in health and healthcare, but through them all, I think one of the most important things, and Don just spoke about it, is I'm a pediatrician. And as a pediatrician, I've spent countless hours talking to families, parents, about what to do for their child, and listening as partners to what their concerns were or were not and how we collectively could answer them. We've been having the discussions as pediatricians about vaccination and the importance of vaccination for many years, and I couldn't agree with the comments of our two speakers more, that it always needs to be a conversation and we join it together, humble, listening, and learning. I'm excited to talk with you today about this important topic. We know that strong confidence in the vaccines within communities leads to more people getting vaccinated, which leads to fewer COVID illnesses, hospitalizations, and deaths. We appreciate this initiative's focus on community and on trusted relationships. And as I say, there's nothing more important in health and healthcare. I'm going to share a little bit more about the details of the available vaccines, our current distribution and administration, vaccine safety, and an overview of CDC's Vaccinate with Confidence framework and toolkits and other resources that may be of help to address vaccine hesitancy. An overview of current partnerships and programs that include expanding access to vaccines, identifying and addressing barriers to vaccine uptake, and building vaccine confidence among healthcare workers and their patients, and ultimately listening to all of you today to learn what we here at the CDC can do better and can do in partnership with all of you. As has been said, vaccine is a critical tool in bringing this unprecedented pandemic to an end. As we know, multiple vaccines have been developed and been put through clinical trials. We've talked about the 3 that are currently available: the Pfizer-BioNTech, 2 doses, 21 days apart for persons 16 and above; Moderna, 2 doses, 28 days apart for persons 18 and above; and a Johnson & Johnson 1 dose for people 18 and above. All of these have been effective in preventing serious illness, hospitalization, and death from COVID-19. And I think, as you heard, as of April 4th, over 207 million vaccine doses have been distributed in the United States, with over 165 million being administered. That includes over 99 million people initiating vaccine and over 61 million persons fully vaccinated. That's a great story, but we have a long ways to go, and I'm glad we're here today talking. We continue to work with states to understand roadblocks and figure out how to overcome challenges in distribution and administration to ensure that we are getting vaccines into arms as quickly and as safely as possible. We, the CDC, know that vaccine competence is built on the foundation of vaccine safety. COVID-19 vaccines are safe and effective. They were evaluated in tens of thousands of participants in clinical trials and met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support emergency use authorization. Many vaccine safety monitoring systems watch for adverse effects or possible side effects. This continued monitoring can pick up any adverse effects that may not have been seen in clinical trials. If we see an unexpected adverse event, experts quickly study it further to assess whether it is a true safety concern. Experts then decide whether changes are needed in our vaccine recommendations. This monitoring is critical to help ensure that the benefits continue to outweigh the risks for people who receive vaccines. Here at the CDC and at FDA, we have a number of tools that do this. The Be Safe is a new smartphone-based after-vaccine health checker for people who receive COVID-19 vaccines. We now have over 8 million users enrolled. Over 80,000 individuals have self-identified themselves as pregnant. They are reaching out to follow both the mother and baby through a pregnancy registry. We also have the Vaccine Adverse Event Reporting System, or many of you know as VAERS, that is work of both the CDC and FDA. This national system has been in place for many years and collects reports from healthcare professionals, vaccine manufacturers, and the public of adverse events that happen after vaccination. VAERS also collects reports of adverse events that are unexpected, appear to happen more often than expected, or have unusual patterns. These are then followed up with specific studies. To date, we have not had any significant safety signals in VAERS related to COVID vaccines. So let's talk about vaccine competence for a few minutes. Most people in the United States are planning to get vaccinated with COVID vaccines. And as you've heard, the numbers continue to go up as we do more polls. But we do know that many people may want more information about the vaccines, including the process for developing and authorizing these vaccines, and information about their safety and effectiveness. They may have also had previous experiences that affect their trust and confidence in the healthcare system. Strong confidence in the vaccines within communities leads to more people getting vaccinated, which leads to fewer COVID illnesses, hospitalizations, and death. Many factors influence those vaccine decision-making: cultural, social, political, individual and group factors, and vaccine-specific factors. However, confidence in the vaccines, the vaccinator, and the system all support the decision to get vaccinated. And I think today we're talking about those vaccinators and the system and how having a community-based system really can make a significant difference. Our Vaccinate with Confidence strategy is built on 3 pillars: build trust, empower healthcare personnel, and engage communities and individuals. In order to build trust, we've tried to share and will continue to share clear, complete, and accurate messages about COVID-19 vaccines and take visible actions to build trust in the vaccine, the vaccinator, and the vaccination system. These are some of the tactics that CDC will be using to reinforce trust. Communicate transparently about the process for authorizing, approving, making recommendations for monitoring the safety, distributing, allocating, and administering COVID-19 vaccines, including how is data handled, providing regular updates on the benefits, safety, side effects, and effectiveness, and clearly communicate what is not yet known, proactively address and mitigate the spread and harm of misinformation via social media platforms, partners, and trusted messengers, empowering healthcare personnel, promoting confidence among healthcare personnel in their decision to get vaccinated and to recommend vaccination to their patients. These are some of the tactics that CDC will be using to empower healthcare personnel, engaging national professional associations, health systems, and healthcare personnel often and early to ensure a clear understanding of the vaccine development and approval process, new vaccine technologies and benefits of vaccination, ensuring that those healthcare systems and medical practices are equipped to create a culture that builds confidence in COVID-19 vaccination, and strengthening the capacity of healthcare professionals to have empathetic vaccine conversations, address myths and common questions, provide tailored vaccine information to patients, and use motivational interviewing techniques when needed. Speaking as a pediatrician, I know learning motivational interviewing techniques can have a significant impact on that conversation with patient and a family. Engaging communities and individuals in a sustainable, equitable, and inclusive way, using two-way communication to listen, build trust, and increase collaboration. These are the tactics that we will be using to engage communities and individuals. Empower vaccine recipients to share their personal stories and reasons for vaccination within their circles of influence. Working with health departments and national partners to engage communities around vaccine competence and service delivery strategies, including adaptation of vaccine provider sites to meet community needs. Collaborating with trusted messengers, such as faith-based and community leaders, to tailor and share culturally relevant messages and materials with diverse communities. This is where we're focused, building trust and helping people make decisions with those who trust them. So Vaccine with Confidence through the CDC is not an advertising, marketing, or communications campaign. It is a cohesive framework to support health departments, healthcare providers, immunization partners, and community partners and leaders in their promotion of COVID vaccines. Strong confidence in the vaccines within communities leads to more people getting vaccinated, which leads to fewer illnesses, hospitalizations, and deaths. We have a number of resources to assist and share information about vaccination. We have an informational guide, How to Build Confidence in COVID-19 Vaccines, with 6 strategies for immunization coordinators to build vaccine confidence within their health system or clinic. We have a number of companion tools, including communications and confidence readiness checklist, the COVID-19 vaccine confidence conversation starter, vaccine with confidence strategy, and building confidence in COVID-19 vaccines among your patients, tips for healthcare providers. These include toolkits, slide decks, information that healthcare providers can print off or use as they talk with their patients. And more information can be found at the CDC COVID-19 Vaccine with Confidence website. I want to very quickly just go over a few highlights of some work that we've been able to do with our local and state partners. We have a cooperative agreement funding to jurisdictions to support vaccination. At least 10% of the total funding received by each jurisdiction must be allocated for high-risk and underserved populations, including racial and ethnic minority populations and rural communities. In order to engage minority communities to build trust and improve vaccine uptake, we are working with diverse organizations and community champions to meet these communities where they are. We've developed a comprehensive program of 20 national organizations to support hundreds of local and community-based organizations to improve both COVID-19 and flu vaccination coverage among racial and ethnic groups. We have the Federal Retail Pharmacy Program with 21 national pharmacy chains and independent pharmacy networks to help administer vaccine in communities across the United States. Almost 90% of people in our country live within 5 miles of a community pharmacy. Pharmacies have unique reach and ability to provide access to COVID vaccine and support broad vaccination efforts. This program represents one component of the strategy to expand access to vaccines to the American public. On March 29th, the Biden administration announced they plan to more than double the number of pharmacies offering COVID-19 vaccines, and that by April 19th, 90% of adults in the US will be eligible for vaccination, and 90% will have a vaccination site within 5 miles of where they live. That's why what we're talking about today is so important, because we can bring the vaccine to communities, but we need to have communities and individuals want to be able to get that vaccination. We have programs with health centers, working with federally qualified health centers. Mobile vaccination units are being supported, over 500 mobile sites in partnership with jurisdictions around the country. We're committed to providing available resources to support our state, territorial, local, and tribal partners as our ongoing effort to provide a vaccine to everyone who wants one. And in addition, I am now working through multiple different HHS agencies to help promote making sure that people who are homebound and people who have disabilities also have access in a culturally appropriate and easy to access way to vaccinations within their communities. And so I'd end by saying, when we talk about community, there are communities within communities within communities, and that understanding works best at the local level. As Don Berwick said, it makes sense that we have to make sure that we consider all of those communities within communities, and we think about the groups that may be left out and how we make sure we always reach out to them. I look forward to any questions, and I will turn it back over to you. Thank you.
Dr. Remley, thank you so much for those remarks. We do have a couple of questions, if you don't mind. The first question comes from a viewer from YouTube. Can you please comment on recommendations for a patient who has experienced severe or serious side effects from a COVID vaccine? Should that individual receive a different vaccine?
Okay, so I'm assuming that individual is talking about their first vaccine. And I would, the first thing I would do is talk to my healthcare provider and to make sure that I understand whether those side effects or those symptoms were related to the vaccine or may have been coincidentally during that time period. That provider can call the VAERS hotline and can talk to an expert about vaccines at the CDC who can walk through whether that was related to the vaccine or not, if the person was at higher risk for that, and then what their recommendations would be for the second vaccine. But I think it's very important because as we know, people have different types of allergies. You can also have symptoms of another health problem that may be coincident to the vaccine. We never want to take anybody's questions about vaccine or vaccine safely lightly, and want to make sure they have an opportunity to talk to a healthcare provider and then also reach out to the expertise at the CDC.
Great, thank you. Another question has come in also from YouTube. The speed of approval causes many to be hesitant, believing that the vaccine hasn't followed the typical protocols. How do we collectively address this issue?
I think that's a very important issue. I think walking through with people that this is not new technology, that this is technology that has existed, that yes, the process itself was speeded up, but as Don Berwick said, the process was speeded up not by cutting any corners, but by focusing research, scientists, clinicians, everyone together on this very important issue. I think of it as, I'm old enough to remember the first moonshot. And this was I think this generation's moonshot to do all they could to make sure that this vaccine was created not just as fast as possible, but as safely and effective as possible. I have complete confidence that there were no corners cut. And also, just as importantly, is the day that the vaccine is approved means, as we talked about, we don't stop monitoring and following very closely. Every day through BSEP, through VAERS, through working with the pharmaceutical companies that make it, we're continuing to monitor for safety, to make sure we look at not just short-term outcomes, but long-term outcomes. And then lastly, I'd say to that viewer, I'm very happy to say that I come from a family of healthcare providers. So everybody in my family has been vaccinated, and we've had all three. We've got some that have had Pfizer, some that have had Moderna, and some that have had J&J. And I can't wait for my grandson, when vaccine is available for children, for them to get vaccinated. So on a very personal, professional level, I'm very confident in the vaccine safety.
Great. And one final question from the audience. If you can just summarize the scientific advice or consensus for women of childbearing age or pregnant women with respect to the safety of the COVID-19 vaccine.
Sure. Working with ACOG, the American College of Obstetrics and Gynecologists, the CDC has recommended that pregnant women be offered the opportunity to be vaccinated, and that they do that in conjunction and having a conversation with their provider, their physician, about whether the vaccine is right for them. We are gathering more information. As I said, we've got 80,000 women now who received the vaccine at time of pregnancy. So we're developing a registry, and I think in the next coming weeks, there'll be information published again about the safety of the vaccine in women with pregnancy. I just saw an article about the fact that antibodies are created and are expressed in the breast milk and are transferred through the placenta to the baby. So protecting not only the mother from COVID infection, but also protecting that infant around the time of birth. So it is, again, I have a very dear friend who is 8.5 months pregnant, who completed her vaccine in the last week. It's important to to protect all of us.
Great. Thank you, Dr. Remley. Thanks so much for joining us today. Very much appreciated.
Thank you.
At this time, I'd like to introduce Katie Capps. As mentioned, Katie is the co-founder and executive director of the GTMRX Institute, and has had a long history of collaboration in multi-stakeholder healthcare environments. Katie, thank you for your leadership and welcome.
Thank you, Anand. I appreciate our partnership with the Bipartisan Policy Center as well. I'm excited to share with all of you today that the Get the Medications Right Institute is launching a new national task force, building vaccine confidence in the medical neighborhood. Our goal is to identify key issues and offer guidance designed to build vaccine confidence in local communities. This work is supported by a grant from Johnson & Johnson, and we will inform strategies to engage teams at the community level to work collaboratively and communicate effectively about vaccination during current and future pandemics by engaging care teams in the local community, coordinating with schools, religious organizations, and employers, collaborating with local, state, and federal agencies, and communicating to ensure effective, efficient, and engaged community response. We at the GTMRX Institute believe that the medical neighborhood is essential and fundamental in implementing programs designed to build vaccine confidence. So today, as part of our partnership with the Bipartisan Policy Center, we kicked off our first listening session for the task force. And I'm delighted on behalf of the Board of Directors of the Get the Medications Right Institute to introduce to you the co-leads of our task force, Dr. Georges Benjamin, Executive Director of the American Public Health Association, and Dr. Paul Abramowitz, CEO of the American Society for Health System Pharmacists. Susan Denzer from the Robert J. Margolis Center for Health Policy at Duke University will co-lead and facilitate our meetings, and I will serve as staff officer. I'm also delighted to introduce to you members of that task force. On behalf of the GTMRX Board of Directors, thanks to all of you for serving. Kate Berry, the American Health Insurance Plans, Ernest Grant, the American Nurses Association, Ann Greiner, the Primary Care Collaborative, Paul Grundy, Innovator and President of the GTMRX Institute, Doug Henley from the American Academy of Family Physicians, Connie Huang, the Alliance of Community Health Plans, Poonam Keller, Tuck School of Business at Dartmouth, Mike Maddox, American College of Clinical Pharmacists, Darylyn Moyer, the American College of Physicians, Deborah Ness, the National Partnership of Women and Families, Anna Parekh, Bipartisan Policy Center, Kathleen Policki, American Society of Health System Pharmacists, Marcus Placia, Association of State and Territorial Health Officials, Chris Querum, the National Quality Forum, Chet Robson, Walgreens, Julia Skatnick, National Association of Community Health Centers, Richard Stone, the Veterans Health Administration, Mike Thompson, the National Alliance of Healthcare Purchaser Coalitions, Toyin Tafade, Howard University, Tony Veruel, University of Pennsylvania, and Susan Winkler from the Reagan-Udall Foundation for Food and Drug Administration. Thank you for participating and serving on this very important task force. And today, we're also releasing a report commissioned by the Institute, Background and Resources to Build Confidence in the Medical Neighborhood. This report offers a level-setting tool for the GTMRX National Task Force as they begin crafting recommendations helpful to overcoming barriers and build vaccine confidence in local communities today and in the future. It can be found on the task force website landing page at gtmr.org. So thank you to all of you. I look forward to hearing the upcoming panel for ways we can engage the medical community to build confidence in COVID-19 vaccines specifically and all vaccines more broadly. Thank you, Anand.
Thank you, Katie. And now we'll move to our panel discussion, which will be moderated by Susan Denser. As many of you know, Susan is a senior policy fellow at the Robert J. Margolis Center for Health Policy at Duke University and has had a distinguished career in health policy and health journalism. Thank you, Susan, for being with us today, and I'll turn it over to you.
Thank you so much, Anand, for that very kind introduction, and to all of our opening speakers for their very, very important framing remarks this morning. Before I introduce the panel, let me just briefly recap what we've already heard. First, from Anand, we heard from you, 167 million people in our country have now been vaccinated as of today, with 61 million of those fully vaccinated. And as we know, the nation reached a record 4 million vaccinations a day over this past weekend. At the same time, we've got new variants of SARS-CoV-2 and many people abandoning the mitigation measures like wearing masks and social distancing. So we're far from out of the woods when it comes to this pandemic. Most people in the US, as we heard, do want to be vaccinated, but about a quarter of people in polls are saying they won't be vaccinated. And from Senator Frist, as we heard, with vaccines being the game-changing tool of this pandemic, we've got to accelerate our efforts to get more people vaccinated. We have a moral imperative, he said, to get as many people as possible vaccinated to reach herd immunity and break that chain of transmission of the SARS-CoV-2 virus. From Don Berwick, we heard that the pandemic has been a call to arms for our country in so many ways about the need to improve health and healthcare in America by tackling health where it begins, which is in communities. And really, vaccination now is part of an overall approach to improve the health and well-being of communities as a whole. It is the right place, as he said, to begin to build the drive to maintain and increase confidence of vaccines. And from Dr. Remley at CDC, we heard that as a pediatrician, she knows the importance of having conversations with people, with parents, about the importance of vaccines. We heard about all of the tools that the CDC has created now to enhance confidence, the Vaccinate with Confidence framework, the COVID vaccine Be Safe health checker that people can check after the fact, as after they've been vaccinated, the pregnancy registry that she mentioned, along with many other tools and toolkits available through CDC to build confidence. We also heard from Katie Capps about the report that the Get the Medications Right Institute has just released, showing that vaccine hesitancy has been a long-standing feature of our country and indeed of many societies around the world, but that there are also very well-known ways of addressing it. We know that Black populations have well-founded historical grounds for distrusting much of the medical and scientific establishment. And of course, that distrust has increased generally in recent years. Don Berwick said that people do what makes sense to them. And now we face the very important point of building their trust, correcting misapprehensions, illuminating myths, and taking other steps to build confidence. That means, as Don Berwick said, particularly engaging people in that trusted medical neighborhood, the primary care doctors, the pharmacists, the nurses, and others who already have a lot of trust of the patients they serve. And it's time, as Don said, to tap into that trust, to build that confidence, take advantage of all of the other entities that can come together, public and private partnerships, employers, businesses, faith-based organizations, and others, to turn that trust to the goal now, very importantly, of building herd immunity in our population. So with that as just a summary of what we've already heard, let's turn now to our distinguished panel, and let me introduce them now. I do want to remind the audience that they are open for questions, so please use that live chat feature on YouTube or Facebook, or go to Twitter and use hashtag BBC Live to tweet us your questions. Our panelists include Sri Chagaturu, MD, who's the Chief Medical Officer of CVS Caremark. And CVS, as we know, has played a vitally important role in vaccine rollout. CVS also recently issued 2 white papers addressing the issues around vaccine hesitancy and confidence that I know Sri will be happy to address. We also are delighted to have Lisa Fitzpatrick, who's a physician, the founder and CEO of Grapevine Health, which is an organization that creates health promoting content for underserved and under-resourced communities and builds trust through delivery of credible and community-focused health information and content. We're also very happy to be joined by Bruce Gellin, a physician also president of global immunization at the Sabin Vaccine Institute in Washington, D.C. And the Institute seeks to make vaccines more accessible to enable innovation and expand immunization across the globe. Bruce also served as the Deputy Assistant Secretary for Health and the Director of the National Vaccine Program Office previous to his current position. And finally, Howard Haft, who's a physician as well. He's Executive Director of the Maryland Primary Care Program at the Maryland Department of the Maryland Department of Health. His career has been dedicated to solving complex medical care delivery challenges and implementing programs to serve diverse populations in Maryland and across the nation. We've asked all of you panelists today to give particular observations and counsel to the distinguished task force that Katie Capps talked about, again, headed by Paul Abramowitz and Georges Benjamin, as they work to draft recommendations to harness the capabilities of medical neighborhoods across the country to build vaccine confidence and get us to the goals we've described. So let me turn first, Sri Chagaturu, to you. Drawing on your experience at CVS Caremark on those white papers I mentioned about hesitancy, what do you think are the key points that the task force needs to keep in mind as it drafts its recommendations to build vaccine confidence?
Thank you, Susan, and thank you to the Center and the Institute for the opportunity. And so what I wanted to do over my introductory comments is really talk about CVS Health's capabilities and our vaccine efforts, and then what we've learned and how we're actually using that information to build confidence in COVID vaccinations. So briefly about CVS Health, we have 3 business units, Aetna, Caremark, and CVS Pharmacy. And across our nationwide footprint, we have nearly 10,000 retail locations. And as Dr. Remley mentioned, CVS Health, like other pharmacy chains, is in close proximity to the rest of America, with 85% of Americans that are within 10 miles of a CVS pharmacy. And we have up to 50,000 trusted immunizers, our pharmacists and pharmacy technicians, who are trained, and we'll talk about clinical protocols and training as part of building confidence in the vaccination process. And we have significant expertise and experience in providing a number of vaccination services. With just flu vaccine during the COVID pandemic, we had provided 15 million flu vaccines. We just recently announced that we have surpassed 10 million COVID vaccinations that we've provided for the country. We have, using these assets, the capabilities to provide 20 to 25 million COVID vaccinations for the country on a monthly basis. And CVS Health has been participating in the national efforts through 2 federal programs, the Long-Term Care Pharmacy Partnership Program, where we are now completing that program, where we've partnered with 45,000 skilled nursing facilities and long-term care facilities and provided nearly 5 million vaccinations. And then through the Federal Pharmacy Partnership, where pharmacists and pharmacies that are in the community are providing community-based access. And we'll talk more about that program briefly, but let's get to the topic of building confidence. And what are the drivers of confidence? And we've conducted a number of white papers and with some interesting insights on what drives confidence. And then there's really 3 strategies: making sure that it's easy to get the vaccine locally with an explicit focus on equity, making sure that we have trusted clinicians and protocols, and making sure that we amplify the messages around safety and efficacy using multiple communication modalities. So let's talk about our white papers and research. We've conducted a number of national surveys from November onwards, essentially monthly, where we have surveyed across the country thousands of individuals mirroring the demographics of America about their intent and their reasoning around getting a COVID-19 vaccine. And early on, we saw a very large movable middle. So we had bookends, about 45% that said they would either get the vaccine or were not interested in the vaccine, but 55% who were in the middle that were just either waiting to see what would actually happen and would make a decision later on. And what we have seen also is that varied by race and ethnicity, with greater hesitancy among Black Americans and Hispanic Americans than other Americans. However, as the pandemic has progressed and as vaccination efforts has progressed, what we have seen is that the hesitancy has decreased in the most recent months. And when we ask what will help you with making a decision, clinicians matter. Hearing the messages around vaccines from trusted clinicians are critically important. And when we ask those who are willing to get the vaccine, they say a return to normalcy is really important. They want to get back to a normal life. The second piece that has really arisen recently is an interesting one, which is what I'm calling a network effect. It's knowing that somebody else has received a vaccine and it was safe, efficacious, there wasn't really much issues around it. And that has then led people to say, well, I know people who have gotten a vaccine, so why I can get a vaccine as well. For those who are hesitant, it continues to be around safety and efficacy. They want to hear from clinicians about the safety and efficacy, and they want to hear from their community trusted clinicians. And so as we think about in the next minute or so, and I'll wrap up, we are committed to making sure through the CVS pharmacy retail chains and the federal pharmacy partnership to make sure that the vaccine is available locally. We have turned on stores based on social vulnerability index and our local understanding of communities to ensure that we are providing access to underrepresented minorities. We then partner up with community-based organizations that know the community to amplify messages about availability and how to do the scheduling. And that has led to nearly 34% of the individuals who are coming to our stores are underrepresented minorities who are getting the vaccine, where we see that nationally hovering around 20%. So these efforts of being conscious about store location and then amplifying the messages with trusted partners has been critically important. As vaccine availability expands, we'll then continue to provide vaccinations outside of our retail locations with off-site plus transportation support with partnerships with organizations such as Lyft. We have built out a training program to ensure that our clinicians who are providing the vaccinations are knowledgeable about the questions that patients would have when they come in. We have a greeter up front at the store to answer questions about the process as they go through the process. Our digital scheduling is also connected to educational efforts to ensure that people have questions answered before they even go through the process of getting the vaccine. So again, amplifying, having trusted clinicians, making this accessible in the community and amplifying messages around safety and efficacy are critically important in us building vaccine confidence in the neighborhood.
Well, thank you so much, Sri. And that is really remarkable success, as you said, 34% underrepresented minorities being vaccinated through CVS pharmacies versus the national average of 19%. Really a remarkable achievement. And that takes me, Lisa Fitzpatrick, to you. Having heard that success story and recognizing your own extremely important work and finding the messages that resonate with Blacks in particular, and those in vulnerable communities especially, what do you think are the most important takeaways for the task force in terms of thinking about reaching the people, particularly who seem to already be moving out of that movable middle that Sri referenced, but may still be having concerns about the safety and efficacy of the vaccines? What messages do you think are most important that will resonate with those communities?
Thank you, Susan, and good morning, everyone. And thank you so much for including me on this panel. I think this is a really vital conversation. I'd like to tell you a little bit about what we've been doing to set the stage for my remarks. I want to focus my remarks mostly on the messengers and the message, because I think that's what it will take. If we focus on who's giving the information and what they're saying, I think this is how we continue to move people on what I call the vaccine acceptance continuum. So I've not been a fan of this word hesitancy, because it's not the experience I've been seeing. Sure, there are people in the Black community who absolutely will not take the vaccine, but my experience has been when you provide access to the information people need in a trusted way, and we've heard trust many, many times already this morning, I find people are actually looking to get the vaccine. So first, during the pandemic, Grapevine Health, and you heard a bit about it during my introduction, we've actually been out in the community. So we've offered a combination of tech access, so text messaging and email, so people can contact us to ask their questions. We also hold virtual sessions with doctors. So we have a tribe of doctors who have been on rotation answering the community's questions during Ask the Doctor sessions. And then we're also out on the street with we collaborate with social service providers. That's a group I haven't heard much about today, but really, really critical group to the goal of improving vaccine access, because they're already in the community providing social services. They've also built trust with communities. So it's really important to work in partnership with them. And so we've been doing that to be on the ground with them when they're providing services, so that we can hear from people and understand what their concerns are. And we've talked a lot already today about what the concerns are. The top two concerns are, is the vaccine safe, and why do we have a vaccine so quickly? And initially, one of the concerns was around being used as in the community's words, a guinea pig. But once we talked about the number of people who've actually been vaccinated or have been in trials, I am a Moderna trial participant, so I talked to them about my experience in the research trial. So we don't hear those concerns as much anymore about being a guinea pig, but we still hear a lot of concerns about the safety and the side effects and why the vaccine has been produced so quickly. So I bucket the interventions in these two categories, because when we talk to people, whether it's virtually or in the community, we hear misinformation and misunderstanding. So the reason the messengers are important is because people want to hear from a trusted source. And that shouldn't come as a surprise, because we're all the same way. I have people I trust for certain types of information, and the community is no different. And when we talk about the Black community, we often hear, well, we should collaborate with churches, or we should collaborate with athletes. But the truth is, we're not monolithic, and it takes very much a multifaceted approach. I think that the church especially is a powerful influencer in the Black community. But a lot of the people we're interacting with in this movable middle are actually not being influenced by the church. So we have to think about what are some other influencers, and who are they? We also haven't talked about how people get their information. They get their information through word of mouth a lot of the time. So, and that's the reason our company is called Grapevine Health, because we recognize a lot of health information is being transmitted on the grapevine, but we're not there to correct the misinformation. And so this pandemic has provided a perfect opportunity for us to learn and listen to understand where the misinformation is coming from. So I think with respect to messengers, in addition to the churches and influential partners like athletes or visible people, we also need to include healthcare providers. But I'll just tell you a quick story. that caught me off guard. In one of these Ask the Doctor sessions, someone said to me, well, my doctor told me not to get the vaccine, so why should I believe you over my doctor? And my doctor knows me and I trust my doctor. So that told me that we also need to implement training and access to resources and information for some providers, because the provider community is also not monolithic. So even though we think of providers as trusted messengers, it's not a foregone conclusion that all providers will understand the research or even have been trained in academic settings where they may have participated in research or referred patients into research trials. I think we take all these things for granted. And the public sees us as science messengers. But sometimes some of us need a little bit more help and more support. And so I think this is an area I would love the committee to think about. How can we provide the resources for primary care providers in particular, since they are on the front lines and they're trusted messengers, to ensure they have the information they need. And then finally, I'll turn to messaging. And this is the bread and butter of what I focus on. So ensuring people understand what we're saying. And we have been asking people, both virtually and in person, if they understand words like antibody, immunity, efficacy, and they don't understand what we're saying. So I think it's really important, it's essential that we find better ways to communicate this information using metaphors, using examples, relatable examples that help people understand what we're saying and frame the messaging. The other playful interaction I have with the community is I ask them if they know the difference between CDC, FDA, and NIH. And I haven't found anyone yet who can tell me the difference. In fact, most people think Dr. Anthony Fauci is the head of the CDC. So this is an example. I'm offering this as an example for why we need to think about how we're communicating health information, because we take it for granted. We're very close to the information. And so I would love to see some attention in the report to focused on how we communicate in plain language. I mean, it's possible to be scientifically credible and also speak in plain language so that people understand what we're saying, because otherwise we're just leaving them behind. And the final thing I'll say before turning this back to you, Susan, is that I think it's really critical for us to deploy vaccines into communities. And the reason this is important, because we talk a lot about equity now and ensuring people have access. So even if we provide lift vouchers, and I think these interventions are incredible, and I think we can reach many more people with a lot of these interventions. But we sort of have a last mile problem now. And so to get those people who are still in the movable middle, but it's taking a little more time, energy, and intervention to move them toward vaccine acceptance, we have to take the education and vaccines to them. So I think if we think about strategies for that, all of these ideas we're hearing today, I think collectively will get us to where we need to go. So thanks very much for having me here.
Great. Thank you so much, Lisa. And Bruce Gallen, just to pick up on some of the points that Lisa made, she talked about her organization, Grapevine, and the fact that it was named after the grapevine, the notion of how people communicate. Both, Bruce, in your role at Sabin, as well as your prior role at the National Vaccine Center, you knew this grapevine well, and the grapevine has a lot of participants on it saying different things. And as Lisa said, sometimes that information is wrong and needs to be corrected. What do you think are the most important steps now that need to be taken to get the right messages out through the right messengers and move the people who really now are going to need to be moved toward a position of vaccine confidence?
This has been such a rich discussion, and I know that the task force is taking taking great notes on all the things they can go forward. Actually, as I think about that, maybe this is another opportunity to think about what we're doing now. And I think this focus on local, this focus on place, as Don Berwick said, this focus on the medical neighborhood is critically important. And we shouldn't just do it for COVID. We should take advantage of this and build it out so we have this not only for other vaccines, not only for children, not only for adults, but for other things, because this is where it's going to matter. Because what at the heart of this is where people can get trusted information that's going to improve their health. That's what we're trying to do here. We're doing it in a very narrow way around the COVID vaccine, but let's not lose this opportunity to think about this chance to build out this part of the system, which we all recognize is critical. Local matters most. It's those trusted voices that matter most, and people are going to turn to those trusted voices. What Lisa described as the grapevine is exactly right. I think of it more of more of a technical term of the information supply chain. And everybody in that chain needs to know what's happening. They need to know the answers. They need to know how the system works. So, and in some ways, the issues are the same globally as they are within the United States. The big difference is supply, and we won't dwell on that now because that's a separate issue. But when it comes down to the community level, all countries have to think about equity in advancing the health of their communities. And it gets down to the community level of where people are going to get trusted information to make the right decisions for themselves. But I think we should also take the time to in the same way that Lisa talked about not using hesitancy, I think we should be careful about the use of that word because a lot of things get swept into that. And we need to make clear where there are issues of access versus issues of people's reluctance to actually step up to the vaccination clinic when supplies are available, when otherwise they can get it. And we need to make sure that those are handled. But part of that access is not only the vaccine and the opportunity for vaccination, but the information. Because at the same time, people may not have places to go to get trusted sources of information. We need to take a hard look at that. And I think that's something the task force should really drill into, of how to be sure that people who are sought for their trust, for their trusted information, have the right information. Sometimes they may have it wrong, and sometimes it may have been contaminated by devious efforts of disinformation to try to fuel some of this. And I think we just need to make sure that at the end of this, where people are going to seek information, get it from trusted sources, those sources have the right answer, or if not, can point people to where those need to be. I think Senator Frist set this up really at the beginning as meeting people where they are, which is not just a geographical statement, but it's also a philosophical statement. Sri talked about moving to vaccine in some of the centers of the geographies that are most affected. That's a place to get vaccines where they are. Lisa talked about going even further out into the communities to make sure that transportation is not an issue and vaccines can be available. But meeting people where they are is also about what they think of this, what they think about this whole process, what they think about the system, what they think about vaccines in general, and the ability to address those questions. In my role at HHS for 15 years, that's where Anna and I started early on together, what I looked at from this perspective of the National Vaccine Program Office was the overall system. Everything from the surveillance that CDC and the states do to try to figure out what the problems were, to the whole research and development enterprise, how vaccines are approved, how they are recommended by the ACIP, and how they're used, and measuring the overall impact. I think that's another overlay of confidence. People need to, it's a complex system, but I think to understand that all the elements of those systems and how they work and the degree of transparency. And I think that's central to trust. And that transparency is really very important. And I'll just give one example, and I know that we'll have a chance to talk some more, is the FDA process. I was a former member of the Vaccine and Biological Products Advisory Committee. And the advisory committee process in the United States is unique in its transparency. It has to have its conversations in a public forum. Now with Zoom and YouTube, everybody can watch and everybody can see independent experts kicking the tires, looking at the data, asking tough questions, and that's what goes into making decisions. There are similar places along the chain, but transparency all the way through into how the vaccines work, how they're monitored for safety. Karen mentioned that before, that vaccines continue to be evaluated when they're in use. All that is critically important because that's what people look at to make sure that they're making the right decisions for themselves. So I'll just stop there, but just saying that I think that the task force has got plenty to do, and I would encourage them to think through not only how they're going to continue to work on this problem, but how it's going to translate into a better sense of medical neighborhoods across the country.
Great. Well, thank you so much, Bruce. And now, Howard, have to you. And capturing some of the themes that we've heard from your fellow panel participants here, moving people along what Lisa called the vaccine acceptance continuum, which, as we know, a lot of people have already moved. The ones who may be left in the month or so are going to be different from the people who've already moved out of that movable middle that Sri referenced, and the role in particular of primary care clinicians as the trusted messengers, as those who already have the trust of their patients and others in the community. Let's talk a bit about, from your perspective, about recommendations to the task force around primary care in particular. Now, as we heard, not all doctors are always as informed as they should be, and they also can be susceptible to some mixed messages. Give us a sense of what needs to be done at this point to continue to reach out to the primary care community to make sure that they are well informed and also extremely well equipped to convey these messages that will help people move along that continuum that Lisa described.
Susan, thank you very much. And it's a pleasure to be adding cleanup in this illustrious panel and addressing some of those issues. I really believe that the majority of primary care providers are, in fact, well informed and hope to and seek the information that they need. There's always a minority of individuals in any particular profession who don't adhere to the highest standards, but I don't think that's typical for primary care. But I think I'd like to approach this from the perspective of what this pandemic has really done, which has shined a very bright light on the fundamental issues that we have in the country with health equity and health disparities. We know that with this pandemic that communities of color have been disproportionately impacted in terms of, for COVID-19, in terms of increased numbers of cases, disproportionately increased hospitalizations, increased deaths, while at the same time they've not had the same kind of access to testing or even the monoclonal antibody therapies that are available. And it just shined a very bright light on things that we need to address, and I think things that can be addressed, at least in part, through the medical neighborhood and primary care providers. We know that these disparities are not biological in basis. They really have their roots in things that have to do with both health equity, those social determinant underpinnings for health equity, the education, transportation, nutrition, economics, the things that are barriers for people being able to get to the access that they need for many of the things that would be helpful for them to reduce the disparities. But it's also the flip side of that has been addressed before also, is this issue of acceptance, which is a much more personal issue. It's impacted by all those social determinants of health, but it comes down to where people are in kind of their stages of change, whether they're contemplative, pre-contemplative, and that's something that needs to be dealt with most intimately, either in the grapevine or with a trusted provider. I think as Dr. Frist said, it's really about reaching people where they are physically, but also where they play, pray, work, love, all those things that go into their lives, and that's something that goes to the understanding of an individual that has to be a very intimate kind of conversation. And I think that's one of the places that primary care really can lean in, because they've developed with their patients these longitudinal relationships that go for years, and they really do understand all of those aspects of people's lives that might not be available from data, but more from a longitudinal relationship, talking intimately to someone in an empathetic way. So I think it comes down to primary care being part of the medical neighborhood, but being a really essential, foundational part of that medical neighborhood to supplement whatever else happens in hospitals and the great work that Sri is doing in pharmacies and the broad reach that they have, but probably in a more intimate level. We know that from surveys that when we survey people, the people that are most trusted in terms of medical information clearly are the physicians and the providers, and particularly the primary care providers. And we survey people, we know where people prefer to go for their vaccinations. Typically is their primary care office. It's a comfortable place. It's where they've usually gone many cases for their vaccines. They know the people there. It's easy access. They're widely distributed, just like pharmacies, widely distributed, perhaps even more widely distributed across the country. And with extraordinary hours and access and those kinds of things. And like pharmacies also, they've already had the built infrastructure, the trained staff, people where someone can go and they're confident that this is someone who usually gives me my vaccines. This is a place that I'm comfortable with this. I know we don't have to build a new mass vac site. That's not to say that mass vac sites are not absolutely essential now. I think they address the 2/3 of the population who are just very comfortable with, now I need to get a vaccine and I'm going to go to the quickest, easiest place that I can go to. And I've already passed that issue of equity. I don't have those barriers. I've passed the issue of confidence in the vaccine. I don't have those barriers. Just sign me up. And that's good. But we've still got this 1/3 of the population, perhaps, or quarter, that really needs to have more intimate kind of relationship with who is vaccinating them and the reasons why they're vaccinating them. And I think the primary care has that ability also to, instead of being a push that we do with like large mass vac sites, to just kind of push people into them and say, we're going to open up a registration process and we'll push you into the queue. The primary care providers have these intimate relationships and they can pull people in, people, particularly those that they know have not been vaccinated. So as an example, for Maryland, we have this Maryland Primary Care Program. I'm happy to be the executive director of that. It's an advanced primary care program we run together with the State Department of Health and the Center for Medicare and Medicaid Innovation. It's got 562 primary care sites, including FQHCs across the state. So it's got a broad reach. And we're able to provide all of those primary care practices and other primary care practices across the state data that tells every one of them about all of their patients, agnostic to payer, their status in terms of whether they've been immunized, when they've been immunized, which vaccine they've had, and then also data about their age, race, ethnicity, and underlying medical conditions. And that allows the providers then to be very selective and say, I can reach out to those who haven't been immunized, particularly with a sensitivity to the hardest to reach, the most vulnerable, perhaps for a variety of reasons. Sometimes that's racial, sometimes that's ethnic. And it's remarkable that we've seen, even in the early days, that when we do that, when we allow the providers to pull people in based on their knowledge, that people come in very easily. And they are often very thankful to say, I was just waiting for you to be able to give me my vaccine. And the results from that are that they provide a very equitable product. When we look at the data, the people who are vaccinated in those practices match exactly the neighborhoods in which the practices exist. So they do meet this kind of hurdle of not only being accessible and trusted, but also being accessible and equitable at the same time. So it's not that that's the only way to do vaccinations. Clearly, all of the things that we've talked about before are really critical, important things. But it goes back to, I think, being part of the medical neighborhood and being able to, as Dr. Frist said, to be able to reach people exactly where they are. There are 200 or 320 million people or so in this country. Everyone is going to be reached in their own unique way.
Great. Well, thank you, all of you. We had some questions that came in from the audience, and we have limited time, so I'm going to try to work my way through as many as possible and direct those questions to one of you at a time, if that's all right with you, so we can get to many of these questions. And I want to start with a question to Lisa, which is that you've got a lot of work to do to communicate along the grapevine. How do we make sure people like you have the resources to communicate those messages? And again, not just organizations such as yours, but you mentioned very importantly the importance of social services organizations, as well as those more medical entities in the medical neighborhood. How do we make sure they have the resources to address this issue?
Such an incredible question. I appreciate whoever asked this question. I think this is about intention and will, because we have a lot of resources, and a lot of the resources that are needed are actually financial. So a lot of the organizations we work with that provide food, housing, transportation, or employee skills development support, these organizations often struggle to make ends meet. So I think by intention, dedicating resources for these organizations, and then lowering or reducing the barrier for them to access the resources and support. I think about the foundations and the funding organizations that I don't want to be politically incorrect here, but I think there's a mismatch between the mission of a lot of these organizations and the folks who hold the purse strings. And so in order to facilitate their involvement, their engagement, to reach the folks we're trying to reach, we really have to help assist them in gaining access to the financial resources.
Great. Okay, thank you so much, Lisa. And Bruce, I want to go to you next for a question. We have a really unusual circumstance right now, which is that a number of healthcare workers and long-term care workers remain hesitant about the vaccine, or have not moved enough along in the continuum, shall we say, to vaccine acceptance. This seems to be different from what we might have seen in the past. Is it that different, and how do we address it?
Well, thanks. It's really an important question. I think to me, part of what this boils down to is that healthcare workers are a spectrum, and not everyone who's working in the health industry has the same level of education, the same access to information, and are often reflecting views more from their community than the fact that they wear a white coat during the day. So I think we need to acknowledge that, and the data that we're seeing, that tell us that where these gaps are, and to try to, again, just because somebody's in healthcare doesn't mean they're bought into the whole thing, and have to have a clear understanding for them, like anybody else, is what is the issue and how can we help you understand that? It's been laid out a number of times what those are. For those who are waiting to see, they've seen a lot in healthcare, so you would think that would be some part of the argument as well. But it boils down to having a candid conversation with a person about what their concerns might be, and to the degree that you can address those, and to have them make it a best informed decision.
Great. Thank you so much, Bruce. Sri, I want to go to you next with a question, which came in again from an audience member watching it on YouTube. The process of getting a vaccine still remains a barrier for many people, even if they've gotten past hesitancy toward acceptance. And you talked about a number of things that CVS and CVS Caremark are doing to make that process easier, including working with Lyft to just address the very important transportation component. But what else should this task force recommend on that score for increasing the accessibility of vaccines through the medical neighborhood in conjunction with the effort to build confidence?
There's a couple of issues. So one is that the supply has been constrained until recently. And so as supply continues to accelerate, and that will allow for more locations. So we believe that pharmacies will be one of the many channels, but an important channel. So expanding the number of pharmacies, expanding the number of primary care physician offices, hospitals, community-based organizations that are able to provide vaccinations will be important. But once you open up that site, it's really important to amplify the awareness of that site being available in that community, and potentially even thinking about how to notify a community, find those stakeholders in that community who can ensure that people are aware that the store is open or the office has availability. And then I would say that the other complexity that has been making it difficult for COVID-19 vaccination has been the eligibility. And the eligibility has been difficult because it changes state by state and week by week, month by month. I think we're getting to the other end of that because we have a commitment from a federal level to have this opened up in really 3 short weeks. And in many states, they've already opened it up. So I think increased location, simplicity in who's eligible, which we're going to see that erode over time. And then making sure that there's awareness that those sites are open are all really important pieces of the accessibility questions. Not the only ones, but 3 ones that I wanted to highlight here.
Great, thank you so much. And now we'll take what I think will be our final question. And Dr. Haft, I'll direct this one to you. We know that we're only now undergoing trials of the use of COVID vaccines in children, but we need to anticipate parental concerns about vaccination of children. So thinking about that future and the adults who are going to have to be communicated with about the safety of vaccines and efficacy of vaccines for children, how should we think about getting ready to undertake that part of the process, potentially as soon as later this year?
Yeah, thank you. That's Susan. That is a great question. And I think the simple answer to that is start early and be as comprehensive as you can, because this is going to be a redo of what we had to do in the beginning of this pandemic with being able to develop confidence, and what we continue to have to do throughout the pandemic to develop vaccine confidence for adults. It is an entire level of concern when you're talking about your child. I think I'm very encouraged, although I'm not a pediatrician. I know that Dr. Berwick is, for instance, and I have many colleagues and many who are in our program who are pediatricians, and they have been communicating about vaccine safety and efficacy for many years, probably more than anyone has to parents. And we recognize that there is this still going to be a hardcore group of vaccine naysayers, doubters who will, in a very small number, will deny that efficacy. We've seen over the years the outcomes for those in outbreaks of measles and other infectious diseases scattered across the country because of those. So I think we'll just reduplicate our efforts, and pediatricians and states together and the nation will lean in to give parents comfort. But it'll have to be based on the same kind of scientific basis, the same kind of transparency that we've seen with every other aspect of this vaccine rollout.
Well, I want to thank all of you, Doctors Chakaturu, Fitzpatrick, Gellin, and Haft, for a terrific discussion. We've heard so many additional important perspectives from all of you this morning, starting with the notion that we have seen the movable middle, and we've moved a lot of people from the movable middle to along that continuum that Lisa described to vaccine acceptance. We've heard very important observations about the major drivers, messages that help people get there, their desire to see us all return to normal, their desire to be assured that the vaccines are safe and effective. We've talked very importantly about the role of trusted messengers and making sure those messengers have the right messages and are well resourced in order to get those messages out. And then very importantly about building out the components of the medical neighborhood, including bringing in social services providers and others who are able to get those messages out to people along these very important grapevines that exist around our country. So thanks again to all of you, and thanks particularly to our opening speakers, to Drs. Frist and Berwick, to Anand Parekh, Dr. Parekh, also to Karen Remley from the CDC, and to our task force members. We hope that this has been a very important and informative session for all of you. We look forward to working with you as we formulate the very important recommendations that will come out of this effort to continue to move the nation toward vaccine acceptance, not just for COVID vaccines, as we heard from Bruce Gellin, but for many vaccines to come. We know, unfortunately, this will probably not be our last pandemic. We better figure out a way to get messages across effectively and importantly to populations. And I can't think of a better set of people to help us do that than those who have been with us today. Thank you all very much. Thanks to those of us who have joined us through YouTube or various modalities. And we wish you all a very good day and a very, very successful experience as the nation begins to emerge from the pandemic. Thanks again.